So this last video, question number 262. Sodium potassium pump, facility diffusion, active transport. Sodium potassium, active transport. Nerve for the general sensation of the tongue, floor, and mouth injured in surgery, which is that lung, lingual nerve. 80-year female who has smoked 20 cigarettes, smooth velvety patch, leukoplakia or erythroplakia. Smooth velvety red patch is erythroplakia. Giant cell Langerhans tubercle. Patient has Pankos tumor, loss of sensation T1. Median aspect of the arm, Werner root T1. Indication for intubation in burn, facial injury, vesicle, respiratory rate 35. Hypothermic patient investigation will least sensitive for saturation, pulse oximetry. Patient present with history of stoma correction 3 months back, not swelling at the scar with sudden abdominal pain and vomiting obstruction. Malignant melanoma prognosis depends upon breast loss thickness. From adrenal medulla, sympathetic stimulus neurotransmitters secreted at postsynaptic. Adrenal medulla, postsynaptic, acetylcholine or adrenaline. This is postsynaptic is adrenaline. Neurotransmitter secreted adrenaline, and presynaptic is acetylcholine. However, question signifies neurotransmitter secreted in the postsynaptic left, which refers to sympathetic nerve ending, not adrenal medulla or hormonal secretion. So, preganglionic sympathetic acetylcholine, postganglionic sympathetic fibers at norepinephrine, except in sweat glands. Brain deaths can be declared except absence of breathing, no brainstorm reflex, vegetative state, absence of corneal pupillary reaction. Perimenopausal female, 56-year with a breast pain, no medication, diffuse breast, no medication, breast diffuse tender with perimenopausal. MRI or mammogram again. Two abdomen surgical site infection, E. coli or streptococci, staph or yes, staph. 15-year girl with unilateral limb edema, primary lymphedema, 15 years is primary. Mix it on this. "18-year-old smoker is smoking from last 30 years, underwent sigmoid cancer surgery. 80-year LMW plus talking or LMW, only LMW. Crippled ternary. Mother with 2-year-old child can't feel testis. Examination shows one normal testis, other laparoscopy, inguinal exploration. What is 2-year child is there? Other testis is not proper. Initial management. Initial ultrasound or laparoscopy. So there are so many things. Exactly. Vessel compressing third part of the duodenum. Superior mesenteric artery. SOS major tuberculosis abscess comprising nerve lateral to the lateral is L23. Which vessel decides right or left dominance? Posterior interventricular. 45-year-old male with a hydrocele, which layer is responsible for producing tunica vaginalis? 34-year-old man operation with tourniquet, after release of tourniquet, which substance? Bradykinin or nitric oxide? Histamine is released. Always I am thinking bradykinin. Which is least likely in ulcerative colitis? Panarthritis, bronchiectasis. It is D. What is C? Panarthritis. Polyarthritis. Yes, polyarthritis is not there in the. A female having multiple extra intrahepatic bile duct strictures, jaundice, itching history, inflammatory bowel disease, which is ulcerative colitis. Yes, this was about no polyarthritis. So panarthritis. "45-year-old patient with a severe head injury 14 days ago. He is now slow recovery and type of feeding. What he will give? Slow recovery means feeding feeding gastrostomy. Is it there? No. So B has to be there. Nasogastric tube. Female suffering from temporal arteritis 15 days biopsy temporal examine macrophages. 67-year-old man is undergoing transurethral resection of prostate, died suddenly during prostate obturator nerve. A ball hit on the side of the squamous part, a temporal fracture, pterion, extradural hematoma is there, middle meningeal artery. 31-year-old man admitted in an assault outside a nightclub, Glasgow 12, 18, decision taken for which are lens shape, it is extradural hematoma. Extradural and banana subdural. 30-year-old is recent on introducing protruding deviates towards the side of the lesion. Which of the following nerves is affected? Hypoglossal. Sperm passes through which structure after passing through ejaculatory prostatic? Through ejaculatory duct, prostate. So first testicle, then epididymis, then third is vas deferens, fourth is seminal vesicle, fifth is prostate, sixth is urethra. Hong Kong presents with epistaxis and nasal obstruction. Epistaxis nasal carcinoma, nasopharyngeal carcinoma.